Hi, this is Paul Barr with Hospitals and Health Networks. I'm here today with Dr. David Shulkin, Secretary of Veterans Affairs. Thanks for being with us here today.
I'm glad to be here, Paul.
You gave a talk today and you talked about some of the private sector initiatives that the VA is undergoing with hospitals and leadership. Could you talk a little bit about that?
Well, our number one mission in the VA is to make sure that veterans are getting the best care anywhere. And my belief is that the best for veterans is to take what we're doing in the VA that is the best in healthcare and combine it with the best of healthcare in the private sector and offer the veterans an integrated, seamless experience.
And you put out a plea for people to come work for the VA. How extensive would that be?
Well, today we have 49,000 openings in the VA. So we need people to come help us and to join the VA to serve our country's veterans. And that's at every level. We need doctors, we need nurses, we need pharmacists and physical therapists, but we also need clinical leaders and administrative leaders. We have many openings at the top of our organization, and I'm looking for those from the private sector who can help bring their experience about what works in the private side to VA. And I believe that when you take the dedicated professionals who already work in VA and you infuse some new thinking from the private sector, you get a formula for success.
The VA attracted some attention for its move to increase its use of advanced practice registered nurses and physician's assistants. How did that come about and how is it going?
Well, when I took a look at the issue about whether VA should use federal supremacy and move forward with full practice authority for advanced practice nurses, my answer was yes, we should do that. And the reason is that there are many parts of the country that we do not have the ability to hire enough physicians. And so therefore, when you take the capabilities of advanced practice nurses, who, by the way, I've worked with all of my career in my clinical practice, and I still do practice clinically. So I have great experience and great admiration for the competence of advanced practice nurses. I wanted to be able to help solve our access issues, and so I did choose to give full practice authority to advanced practice nurses.
The VA is using an unusual technique with the homeless veterans that you talked about. How does that work?
Well, VA is unique in that it not only deals with the physical health issues of veterans, but it deals with the psychological, the social, and the economic. So if we find a veteran who is homeless, it's very hard to provide good medical care when they don't have a place to get their medications and follow up and a secure place where they can go home at night. So the VA has taken on ending veterans' homelessness. And over the past 5 years, we've reduced veterans' homelessness by 46%. And we're going to stick at this until we end veteran homelessness altogether. So one of the ways that we do that is we have stand downs at our facilities where we invite people in that are either homeless or at risk of being homeless. And we provide them with comprehensive services, medical services, clothing, food, counseling, vocational training, legal help, personal hygiene like a barber or washing their clothes, whatever it takes to help that person get back on their feet in the right direction. And we're very proud of those efforts.
Well, thanks for being with us today.
Glad to be here, Paul.
For H&HN, this is Paul Barr. Thanks for watching.